Oh, the webinar has started. So,
Okay, and I'm still here, and I heard
okay.
that it's being recorded.
Okay. I wonder, Christina, if somebody else goes to the attendee side, do you see the attendees? Or maybe you don't actually.
I'll let you know. I'll text you, but right now I just see you, Frankie, and Marita. That's all I see right now.
Okay. Right. So Frankie, I'm going to ask you to go off camera just until it's your time, and your time starts at 10:41. Yes, Frankie.
That was my bad.
That's okay. That was a thumbs up.
It was supposed to be, and I accidentally hit the wrong one.
Gotcha. All right,
James, are
everyone.
you able to stop the recording and then restart once we're ready to actually commence, just so individuals reviewing this recording, they're not hearing all this housekeeping items?
Yeah, we will trim it.
Oh, great. Okay.
Yeah, in Zoom, they have a functionality to trim the video now.
Oh, neat.
Yeah, they've had it for a little bit of a time, but it's super helpful when you're doing that. That's correct. Yeah, I use it frequently. Yeah, Zoom is making some good ones, and then they also have AI that kind of works really well with that. The only thing is I did not get a background for sound. That was the so they don't have a background. But I wonder if I should make her background. No, the sound careers. Oh, I think she's gonna be on Blur. Should we have music or what should I?
I think that's a good idea.
Or music.
And let's see here. Well, thanks everybody, man. What a interesting project to do. Really, it's been fun. Should it be Taylor Swift radio?
No, please.
What?
Well, I personally would really love that. I don't think it's the cool thing.
Oh, it's not the cool thing?
I mean, I don't know. I think it just depends on who you ask. I would be ecstatic about Taylor Swift radio, but maybe something a little bit more universal.
Maybe something without words, maybe just like some like jazz station.
Jazz, yes. Bring back the jazz festival.
But sometimes, you have to be careful with words, language used in songs.
I'll do a Diana Krall radio station. My question to you is, does it matter if my volume is on high or low? Actually, let me put something clean right now.
And Tatiana, can you look at the Sound Careers and Healthcare email just to make sure if people are having any issues, if they're emailing, we can.
Yeah, let me get on there right now.
Okay.
I have not had anybody message me anything yet.
Okay.
Okay, I'm gonna I was having a little trouble with that Pandora, and I'm gonna not play music only because with all the things that are happening on the computer, I was getting some delays last time, and I just want to make sure that there's not external things that my computer's trying to work with.
Just go ahead and sing, James.
There you go. That's the way to do it. I'm gonna get rid of my
Karaoke.
Okay, so I'm getting rid of YouTube.
Do we have attendees on, James?
For attendees, we have I can allow Laura and Quincy Davison. So I'm gonna allow them to talk. Good morning, Laura and Quincy. How are you doing today?
I'm doing well. We're here from Kentwood High School. We have 4 students that are sitting here um, interested in everything they're getting ready to see today. And so we only registered once because we're on a big smart board.
Terrific. Well, welcome. We're really glad you're here. Thank you. And thank you to the students. We're going to get started here in just a few minutes.
Quincy, what was the name of your high school?
It's Kentwood High School. We're located in Covington, Washington.
Thank you.
Yes, ma'am.
All right. And Laura, how are you doing today? Laura, I think your mute button is on, just so you know. If you unmute yourself, I believe you should be able to talk. Oh, okay. Sure. Laura's working through audio issues um, and that is fine. We can also communicate via the Q&A, which is fine as well. So thank you. All right, we're going to get started here in just a few minutes. We're allowing a few more schools that are coming online. We'll probably get started here shortly, but we've got a fantastic session for you today. We're very excited to be here. We've got some healthcare representatives, physicians, medical assistant, lots of different professionals that happen in healthcare, and this is going to be a fantastic educational experience. So thank you to all the students and the teachers and the educational support. We really appreciate you joining us today. We're just gonna, like I said, it's 9:04. We're probably gonna get started here in just a few minutes. This session is recorded as well. And so we will be offering this recording even after the session as an additional support for that. Mhm. All right, and then just for Laura and Quincy's information, I did allow you to speak. So if there's anything that, you know, in that talking sense, you're allowed to do that. But that's not necessarily saying that you have to talk. It's just allowing you to know the functionality of the webinar format. So we appreciate your support. Thank you. I am also showing my screen. If you are using multiple screens, you might be able to see that a little bit better. But just know that I do have a slide deck showing the title of Sound Careers in Healthcare. So this is day number 2 for the Sound Careers in Healthcare, and we had a big event last week at University of Washington. We had over 500 students join us for a hands-on career fair. It was really, really exciting. Man, students were doing lots of different things in healthcare. I saw them, you know, waddling babies and trying to understand how to care for newborns. I saw them doing exercises and learning about the physiology and the way that their body works. They were also suturing some different areas, you know, like bananas, and I think there were some chickens that were being sutured. I mean, it was really a fun event. So this is the second part of that Sound Careers in Healthcare, and this is our virtual offer. So we are definitely excited. And I'm going to look to Christina and Tatiana to let me know if we should start or how much do we want to wait and pause for any additional people to come in.
I know we're expecting a couple more schools, so maybe just wait maybe 2 more minutes.
Sure, yep, we definitely can. Great. Well, and I will say, I will ask the question, so over to our guests that are here now, And I know you mentioned that you had some students with you, Quincy and Laura. I know you're having some voice challenges that you're working through right now. But if you could let us know what professions are the students kind of thinking about? Are they thinking about physicians or nurses or surgeons or radiologists, or what medical areas are students interested in? Because then we can highlight those a little bit more in the conversation. Please let us know. And then I'll just highlight a question by Christina to Laura. What high school and how many students are in your classroom? If you can look at that Q&A, Laura, then you can go ahead and type in your response.
Hi, my name is Melissa, and I was interested in being a surgeon.
Oh, wow. What kind of surgeon?
I don't know, just like any,
Okay. So you're not afraid of blood, I assume.
no.
Okay, wow, you're better than me because blood makes me a little squeamish. But that's amazing. Wow, that's fantastic. I'm so enamored with your goal. That's great. Um, yeah, we do have some expertise kind of happening that. And what about the other students in your group?
Um, my name is Joanna, and I'm interested in being like a doctor.
Oh wow, a doctor, man. Okay, well, both of you, I'm so impressed with both of your goals, man. Yeah, it's a great profession, and we do have a physician with us. We have two physicians with us. One is a radiologist, and one is a hospitalist. The radiologist, of course, looks at X-rays, makes the assessment, and then the hospitalist. Well, I'll let Dr. Thomas kind of talk about that in his session, but that's more general in the hospital. That's bedside care, and really, that's a range of different expertise that kind of happens in there as well. So yeah, what are the other two students that are with Quincy interested in?
Uh, my name is Alicia, and I'm interested in becoming a doctor as well.
Wow, y'all are all y'all are a motivated group. I love it. It's like, that is fantastic. So terrific. And is the fourth student there also interested in becoming a physician?
Yes, I am. My name is Kenneth.
Wow. Okay, a group of physicians. That I'm impressed already. So that is fantastic.
We've got a lot of students from Meadowdale High School, and they have a lot of interest in primarily nursing, but also sonography.
Okay, sonography. Wow. Man, I just enjoy how everybody kind of keeps expanding their knowledge of healthcare. So sonography, man, what a developing technology to kind of look at that. So, and then I'm reading on the chat here, and it looks like there's a lot of students primarily interested in nursing as well. So that is a fantastic field, nursing. I will say they work, very well with the physicians, the patients, the families. So they're really this all around healthcare type of profession there. So welcome and thank you for joining us. All right. All right, we're going to get started here in just one more second. As I mentioned before, we are sharing a screen. So if we're looking at multiple screens, please do take a look at that. But we will get started here right now. 1 second here. All right, good morning. My name is James Ramirez, and I am your facilitator for today's event. We want to welcome all the schools and students and educators to this Sound Careers in Healthcare 2024. As you can see, the theme of this event is Imagine a Future in Healthcare. To begin, we're going to start out with a land acknowledgement, and this just indicates what a land acknowledgement is. It's a formal statement that recognizes and respects Indigenous peoples as traditional stewards of this land and the enduring relationship that exists between Indigenous peoples and their traditional territories. The land acknowledgement reads, "We acknowledge that this gathering is taking place throughout the traditional territories and successors in interest to the Coast Salish, Duwamish, Muckleshoot, and other allied bands signatory to the 1855 Treaty of Point Elliott. As we begin, we acknowledge and honor the original peoples of this region. As mentioned, we do have 3 facilitators. I am one of the 3 facilitators. My name is James, and I work for Seattle Jobs Initiative. I am a senior consultant. In addition, we have Marita from Seattle Children's Hospital, who you also see up here with me. She is a workforce planning consultant extraordinaire. And then later on in the presentation, you'll see Frankie. Frankie works for Seattle Jobs Initiative and is the Director of Healthcare Pathways. In today's event, we have an exciting timeline for you. In the first hour, we're going to be looking at case study videos that were filmed at Bellevue, at Kaiser Permanente in Bellevue. Then we're going to take a small break around 10:03 for about 7 minutes. And then we're going to transition over to individual career interviews, followed by industry panel discussion. And then we'll have our closing remarks along with a survey. So pretty exciting agenda, and we are very thankful that you're here with us today. In the first part, as mentioned, we're going to be showing videos in round 1, 2, 3, and 4, followed by a gaming platform called Kahoot. It's an online gaming platform, and if you've never played Kahoot, man, it's fun. Marita's going to be leading the Kahoot section there, so you'll want to make sure and have your additional browser. And if you want to go to kahoot.it, that's going to be the website that we're going to be doing right now. And Marita can kind of put that link into the group chat, so you'll see that. And once again, if you want to go to kahoot.it now and just have that ready to go, that would help kind of the process. So to begin, we're going to start with a video, and this is a video that was filmed. In it indicates a patient going over to Kaiser Permanente and seeking medical treatment. And pay attention to the video, because when we play Kahoot, that's going to ask you some questions regarding the video. Here we go. And just so you know, we are working on this on internet, so there might be just a few delays, but we are working through those definitely.
Hello, how can we help you?
Yeah, I'd like to check in.
My apology about that. Let's check that one more time.
Okay.
I'm Kimi Tono.
Okay, Kimmy, do you happen to have your insurance card on you? May I see that, please? Thank you so much. What is the reason for your visit?
I have stomach pain.
Let me grab you a wheelchair, okay? I see that you're in a lot of pain, so. Here, why don't you just take a seat? Just be careful with the pads as to not hit your legs as you're sitting down. Okay. I'm quickly going to finish your check-in registration so we can get you back and see a doctor, okay? Get you feeling better soon, okay?
Thank you.
Yeah.
Hi, hello, Annie. I'm Faye, medical assistant. I'll help you today. Hi. So may I verify your last name and the date of birth, please?
Kimi Tono. February 8th, 1973.
Thank you. So may I ask what brought you in clinic today?
Yeah, I'm in terrible pain for the last few days around here, and I can't sleep at night.
Oh, I'm sorry to hear that. So how many days will
I think this is the 3rd day. And then just keep getting worse, and then constant pain. And then I took Tylenol, but it doesn't work.
Okay.
I have nausea and I vomited 1 or 2 times. Yes, it's very, very painful.
Okay, let me document that. May I ask, is that first time happened or has it happened before?
Yeah, stomach pain like this. I think it's It's a first time. That's
First time.
terrible.
Okay. So can I take some vital signs from you first? Okay. So this goes to your finger. Take your pulse, oxygen level. All right. And we're gonna take your temperature. Okay. Temperature.
Was it okay?
Temperature is okay, but yeah, looks like your heart rate is a little rapid. And can I take your blood pressure? You please rest your arm on the table. Oh, I'm sorry you experienced the pain.
It's terrible.
Okay.
Was it the
Okay,
blood
thank
pressure?
you.
Was it
Yeah,
okay?
the blood pressure is a little high now.
I smoke. Maybe because of that.
So how many years of the history?
Yeah, long time, 10 years.
Okay. Do you have any allergies to medication?
Allergy, yes, I have allergy to oxycodone. Yeah, I think that's all. I have a history of heart attack.
Heart attack. Oh, okay. So when does that happen?
I think 3 years ago.
3 years ago? Okay, I got it.
And I ate sushi 2 nights ago. I hope it's not because of sushi I ate. It was really good. So I think it was fresh.
Okay. Thank you so much. So I've got all the information and then I'll let the doctor know today. I hope you feel better soon.
Yeah, thank you,
Okay.
Kay.
Thank
you
you.
so much.
Hi, Dr. Brenda.
Hi, Faye.
Patient Kimmy is ready for you in exam room.
Okay.
Kimmy came in for the stomach pain, and it looks like it's a pretty severe stomach pain. So she also mentioned she experienced the sweating, hunched over in pain. And she took some pain medications, like Tylenol. She said it doesn't work for her. So her blood pressure is high. It's 156 over 98.
Okay.
And she also has a rapid heart rate. It's 108.
Okay.
The temperature is normal. Patient also reports she has a history of smoking for several years.
Okay.
And also she had a history of a heart attack 3 years ago.
I see.
Yeah.
All right. Well, with her history and her vital signs and her severe pain, I think that we should probably start with an EKG and get some lab work and see what we find, okay?
Sounds reasonable.
Okay.
Thank you.
Thank you, Faye.
All right, fantastic. Now we are going to be, now that you saw that video, what we're going to do is transition over to Kahoot's game to see how much information you've been listening to. So I'm going to transition over to Marita in just a second. But for everyone else in the schools, if you want to go to your computer and go to www.kahoot.it, this is where we're going to be doing the online game. So go ahead and do that now. When we transition over to Marita, she's going to show the Kahoot platform, and she's going to show you the game pin number. You're going to put that pin number in, That's going to put you in, and then you're going to put a nickname for your school. Remember that you only have up to 15 characters, so if your name is longer than 15 characters, you're going to need to make sure and edit that, and then click OK and go. And once everyone is logged in, we're going to let the Kahoots game begin. So we are going to get started right now. And Marita, over to you for Kahoots.
Okay, thank you, James. Can you see my screen? Can you see, just want to confirm you can see my screen?
Yes.
Yes.
Awesome. Okay, here we go. Just a few more. You can see the pin is up in the top, the 4719257. That's the number you want to enter. Thank you, Meadowdale. And once the question comes up, I will read the question for you, and then you will have 30 seconds, up to 30 seconds to answer that question. You are scored, you are awarded points based on correct answers and how quickly you answer that question. So you want to get your answers in quickly. And then at the end of each question, we will see the tally to see who's in first or second or third place. Are we still waiting for Kent Lake, or is Kent Lake MSC?
All right, so go ahead and
It
get
was
your
Kentwood.
entries in.
Kentwood, excuse me. Oh, excuse me.
Is Kentwood in?
There we go. Okay, let's go ahead and get started with our first question.
Here we go.
Here we go. Kimmy came into Kaiser's urgent care with stomach pain. What do you think is going on? And there's more than one answer here.
Marita, it looked like it went to the actual program.
I'm sorry?
It looked like it went to the Kahoots program. I no longer see the question.
Oh.
There you go.
Okay, and the correct answers are food poisoning, constipation, stomach virus, and appendicitis. Let's see if you got those answers correct. Okay, Kentwood is in first place, and MSC is right behind them. Let's move on to the next question.
Way to go.
What tools did the medical assistant use to measure Kimmy's blood pressure, heart rate, and temperature? And again, there's more than one answer here. Hey, great job getting those answers in. And the answers are inflatable arm cuff, thermometer, oximeter, and stethoscope. Did you get them all right? Let's see. Oh, Meadowdale has moved to the front. Kentwood right behind them.
Oh, go Meadowdale.
Okay, on to question number 3. The provider ordered an EKG for Kimmy. What does EKG stand for, and what does it do? Great job getting those answers in. The correct answer is electrocardiogram, a test that measures the heart's electrical activity. Meadowdale's still in the lead, and MSC has now moved into second place. Great job, everyone. Okay, now I'll send it back to you, James.
All right, fantastic. We're going to continue on, and good job on the gaming. Man, that is looking really fun. So what we're going to do is we're going to go now to another video. I am sharing my screen, and we're going to look at that video now. This is the second part of that video that was filmed, and here we go. And once again, there's a few delays just as we're transitioning over screens.
Can you hit presentation mode?
Yes, please.
Hi,
Hi.
I'm Ali. I'm here from lab to draw some blood and do EKG. We're gonna put some leads around your chest.
Okay.
James, we're not seeing presentation
okay?
mode. We're seeing the presenter mode.
Okay. Thank you.
Okay, let me just pause that video. Here we go. I'm going to reshare that. Do you see that video?
Yes.
Perfect. Here we go.
Yes, please.
Hi,
Hi.
I'm Ali. I'm here from lab to draw some blood and do EKG. We're gonna put some leads around your chest.
Okay.
Is that okay?
Mm-hmm.
Okay. Thank you. It took longer to put the leads on than doing the actual EKG. All right.
Oh.
Now we're gonna take the wires off of you, and we're done. Okay, Kimmy, we had your EKG. Now we're gonna do a blood draw. All right.
Okay. Mm-hmm.
I'm gonna come a little bit closer to you, and then we're gonna find a good vein, and then draw a little bit blood. Okay.
Yeah. Ali, sorry. My veins are all bad.
It's
They're very tiny.
ways to.
Are you good at this?
You know, I'm okay.
Okay.
Okay, now do me a favor. Go ahead and pump a couple of times and
Okay.
hold tight.
Mhm.
Thank you. Perfect.
I trust you, Ali.
Oh, don't worry, you're in good hands. Okay, you're ready?
Mm-hmm.
It's gonna be a tiny poke.
Okay.
1, 2, 3. Here we go.
Oh.
Now I'm gonna start drawing blood. All right. So relax your bit. All right. right. Thank you. Thank you so much.
Thank you, Ali.
Have a great day.
Getting a tube from the pneumatic system. This is Kimmy's blood sent down from the 4th floor primary care from the doctor. Let's see. Just going to print our labels for the lab, label the specimens, spin them down to be processed, get the doctor results here. So that'll go for 10 minutes. So you're gonna get this specimen out of the centrifuge to separate it. Oops. I'm just separating. Don't want to touch the red blood cells. Just getting the serum off the red blood cells. Getting rid of the red blood cells. And then this is the part that we test. So the centrifuge is done. Take the blood out. I'm gonna walk over to the machine and load the machine so we can get the doctor results for his stat specimen ordered for Kimmy.
All right, fantastic. That was our second video. We hope you were paying attention because we are now going to be transitioning over back to Marita for the game of Kahoot. Marita, back over to you.
Okay. Sure you can.
We can see your screen.
Okay, there are 4 questions in this section. So here we go with the first question. How many EKG leads did the lab assistant place on Kimmy to measure the heart? Great job getting those answers in. And the correct answer is 10. With that, we'll tally points. Okay, and Meadowdale is in the lead. On to the second question. Why did the lab assistant place a tourniquet onto Kimmy's arm before drawing blood? Did you get it right? It increases the blood flow into the veins and makes them more visible. Okay, let's see. KW has moved into the lead with Meadowdale right behind them. Here we go to question number 3. How did the centrifuge machine separate Kimmy's blood into its components of serum and red blood cells? By spinning the test tubes at very rapid speeds. Correct answer. And KW is still on top. Here's our last question for this section. What were the steps for processing Kimmy's blood? In what order? Okay, and the correct answer is draw blood, centrifuge blood, separate blood, and test blood. So at the end of round 2, in the lead, we have Meadowdale with KW right behind, MSC and Kentwood. Now back to you, James.
All right, the competition is close. Wow. So good job there, man. I love seeing kind of those scores go up and down. So make sure you're paying attention to those videos and we will continue on. We've got 2 more videos. They're a little longer. They're about 10 minutes each. So we're going to be showing that right now. I am showing my screen. So I just need a verification that my screen is showing and I'm going to play that video. Perfect. Thank you. All right, let's play the 3rd video. Here we go. Pay attention. You're gonna get quizzed on this. And as we said, we're doing this streaming from our own residence, and so there's a little delay on that YouTube video, but it'll play here in just 1 second. And just once again, this is a little bit longer video in that treatment that is happening with Kimmy. Here we go.
Hi, Kimmy. I'm Dr. Brenda. I heard that you're having pain in this area. Can you tell me more about it?
Yeah, it's been having the terrible pain for last few days and constant, and then I've been vomited one time and having nausea, and I think it's getting worse. And I ate sushi 2 nights ago. I think it was fresh, and then I don't think that is the cause of the pain, but it's really, really terrible.
And can you show me where it's hurting?
Yeah, it's around here. I don't know where exactly, but around here.
We got some of your lab work and the EKG back, and they look okay. But now I'm going to do a belly exam, okay, to see where it's hurting exactly.
Okay.
Okay. Does it hurt here?
Yeah. Gentle, gentle.
Wow, that looks like it really hurts. So what we're gonna do is, I think what I'd like to do is get a CAT scan, okay, to see what's going on in your belly. All right, and then we're gonna get you some pain medication.
Okay.
Is there anything you can or cannot take?
Oxycodone makes me nausea.
Oh, I see, okay. Are you feeling nauseous right now?
A little bit.
Okay, so what I'm gonna do is I'm gonna order some pain medications, and then I'm gonna call CT so you can get a CAT scan of your belly.
So what is a CAT scan?
Oh, a CAT scan is a machine where it actually x-rays your intestines and your belly and will figure out what's going on inside there, why you're in so much pain.
Radiology? Oh, is that a lot of exposure?
What do you mean by exposure?
For the radiation.
Oh, so, we want to see what's going on inside so we can, if it's anything surgical, we can fix that. So I think that's a little bit more important at this point.
Oh, okay.
Yeah.
Okay.
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 All right. Do you have any questions right now?
No, it doesn't no pain with that procedure.
Oh, with the CAT scan procedure, no, there's no pain at all.
Okay. Okay. Good.
Okay.
Hi. Hi. Okay. Thank you.
Hi, Kimmy.
Hi.
My name's Tyler. I'm gonna be doing your CT today. Have you had a CT before?
I think so. It's a long time ago.
Gotcha.
I forgot.
So I'm gonna have you stand up,
Mm-hmm.
and we're gonna go head up there in that divot, okay?
Okay.
Just ease down, and then throw your legs around here.
Okay.
Perfect. Then just ease back. Great job.
Yes. Thank you.
I'm just gonna test out your IV, okay?
Mm-hmm.
Does that feel okay?
Yeah. Okay.
I'm gonna hook you up and give you a test injection.
Mm-hmm.
1, 2, 3. Does that feel okay?
Yeah. Feel good. Mm-hmm.
Just stay as still as you can for this test, okay?
Okay.
Can you tell me your name and date of birth?
Akimi Tono, 1973.
Okay, perfect.
Hi, Brenda. Good
Hi, Bob.
afternoon.
So what do you see on Kimmy's CAT scan?
So, you have a sick young lady here. So she presented to you with vomiting and extensive abdominal pain. And we did a CT scan. These are our cross-sectional images, like a loaf of bread, one slice at a time. These are looking at Kimmy from the front and Kimmy from the side. And Kimmy has an excessive amount of fluid in her stomach, really dilated fluid. She's got a dilated duodenum. The jejunum is really dilated right down till we come down to where she's exquisitely tender, right in the left lower quadrant. And she has a small bowel obstruction. She has not perforated yet. She has a small bowel obstruction. There's no evidence of free air in the abdomen, no evidence of a perforation, no evidence of an abscess. There's no evidence of any other inflammation in the distal bowel. So I get to ask you, has she had surgery?
Not that I know of.
Okay, then this is probably not an obstruction due to an adhesion. Does she have a history of inflammatory bowel disease?
Nope.
Okay, so, and there's no evidence of inflammatory bowel disease in the remainder of the colon or the remainder of the small bowel. So right here, we have a transition point from large bowel to normal bowel distally. The mucosa, the lining of the bowel, is a little bit thickened. So it's possible, even at her early age, that she has an infiltrating cancer or possibly a small bowel tumor called a carcinoid. That's about it. What additional information may I provide for you?
This is helpful. I think that I'll have to consult surgery.
Yes, this is definitely a surgical abdomen.
Thanks for your help.
You are very, very welcome.
Hi, my name is Dr. Naseem Babazadeh, and I'm a general surgeon. We are going to go through a case of laparoscopic surgery today. Our patient is Kimmy, who presented at the ER with abdominal pain. She had a prior appendectomy when she was younger, and this is important because prior surgery can lead to scar tissue in the abdomen. She has an evaluation in the ER, including this CT scan demonstrating dilated intestine. These round structures along the top are small intestine with fluid, which is white, and air, which is black, and the diameter is greatly increased from normal. This suggests that there is a blockage somewhere causing backup of air, fluid, and the dilation. We decided to take Kimmy to the OR for exploratory laparoscopy. The anesthesiologist puts Kimmy to sleep under general anesthesia. She's positioned on the OR table and her abdomen is cleaned with a sterile soap. Sterile drapes are placed and the surgeon scrubs in, which means cleaning our hands and arms and then dressing in sterile gowns and gloves. 4 small cuts are made on her abdomen and laparoscopic ports are placed. One of the ports is for our laparoscopic camera and the other 2 or 3 ports are for the instruments we use during surgery. Her abdomen is filled with air so that there is working space. We then examine the abdomen. We can see some normal intestine on the left and some dilated intestine on the right. In the case of a bowel obstruction, something, usually scar tissue, is causing a blockage. The proximal intestine, which means intestine closer to the mouth, is dilated, and the distal intestine, which means closer to the colon, is decompressed and normal. We use our instruments to pick up and follow the small intestine from beginning to end. This is called running the bowel. We are looking for areas where there may be scar tissue causing a blockage. We see some scar tissue here, which is causing the small intestine to be stuck to the abdominal wall. Scar tissue can also cause 2 areas of intestine to stick together. Scar tissue can cause things to twist and kink.
All right, we've been receiving a little bit of feedback that the video's a little blurry, so we're going to pause here just a second to see if it catches up on the streaming. As you can see here, we're almost to the end of the video, so if you were able to kind of pay attention to what they were talking about, the video might not clear up, I think, until the next video, but we just have a little bit more here, so we're going to go ahead and press play and see if that clears it up. Just 1 second while it's going on now. All right, just one moment with these technical difficulties. 1 second, please. I think what we'll do in the next time, if this happens again, we'll just let the video run. Looks like it's just still loading right here. 1 second.
Kind of like a hose so that nothing can get through. That is a small bowel obstruction. We remove the scar tissue using surgical scissors and special energy devices that cut through it to release and free the intestine. We have to be very careful not to injure the small intestine while we do this, because that can cause leakage of the intestinal contents into the abdomen, which can make a patient very sick. When we're done releasing the scar tissue and freeing up the intestine so that the bowel obstruction is cured, we take one last look before removing our camera and instruments. We release the air from the abdomen. The small skin incisions are closed with absorbable suture. Kimmy is then woken up and taken to the recovery area where she will be closely monitored.
All right, what a fantastic video. You can see there that Kimmy went over to surgery and had it fixed. So hope you're paying attention. We're going to be going back to the Cahoots game, so get ready. Marita, back over to you for Cahoots.
Okay, here we go with round 3. Okay. Of course, there's 4 questions in this section, and we'll start with our first question. What type of radiation does a CT scan use? Okay, and the correct answer is X-rays. With that, let's look at our leaderboard. Meadowdale's still on top, followed by KW and Kentwood. On to question number 2. In a CT image, the bone is white. What is black and what is gray? Okay, and the correct answer is air is black and the tissue is gray. To our leaderboard. And Meadowdale's still on top, but KW is right behind them. Let's go on to question number 3. What did the CT scan reveal was the cause of Kimmy's stomach pain? And the correct answer is a bowel obstruction. You're all doing great at getting those answers in right away. Okay, and the last question in this section. Oh, I'm sorry, first the scoreboard. And the last question in this section.
Go Meadowdale.
How did the surgeon remove the scar tissue found in Kimmy's intestines? There's more than one correct answer here. Ten seconds left for this answer. Getting your answer. Okay, and the correct answer was all of them. By making small cuts into the abdomen and inserting surgical instruments, by using surgical scissors that cut through the scar tissue, by using a laparoscope, to explain the inside of the intestine, and by using surgery energy devices that emit energy heat to the scar tissue. With the end of round 3, let's look at the scoreboard, and Meadowdale is in the lead, but KW, Kentwood, and MSC are right behind him. Back to you, James.
All right, scores are close. Man, look at that. That is awesome. So great job on paying attention to all those different areas. Now we've got the 4th video, and I am sharing my screen. Just want to verify that that is showing up for everybody. Perfect. All right, here comes the last video. I'm hoping that this does not have too many delays. If it does get fuzzy again, we will stop and let that video catch up in that streaming. But here we go.
Hi, Asha. I have a patient that I want to consult you about.
Okay. Hi, Dr. Brenda.
So my patient is just had bowel surgery, but she has developed a fever. Her blood pressure is dropping. So my concern is she's getting septic from a post-op infection. What would you recommend as far as antibiotic treatments?
Okay, great. I'm just going to look up the patient just a moment. So I'm going to double check if there's any history of drug-resistant infections. Look and see. And I'm not seeing that in their problem list. So also I'm just going to look at their labs and also check the kidney function for the patient to make sure there's no dosing adjustments that we need to make.
Okay.
So I'm going to calculate that based on the last kidney function lab test. Okay, so for this patient, luckily their kidney function is fine. Moving to options, based on their history, I think we would do a broad spectrum antibiotic, which would be pip-tazobactam.
Okay.
I think that would be the most appropriate antibiotic in this case. So let me look up the dosing for you and just a moment on that. Okay, so this is a severe infection. I'm going to recommend the dose be 4.5 grams every 6 to 8 hours. Actually, excuse me, every 6 hours, and over an extended infusion method for this patient. Does that sound okay to you?
That sounds great. Thanks for your help.
Okay, perfect. So we need this urgently, so I'm going to go ahead and let my pharmacy technician know that I'm going to create a stat order and have it print out and let them know that it needs to be dosed right away.
Okay, thank you.
And now after that we have washed our hands, we will need to gown up and get ready to go into the sterile room, sterile environment to make the IV drug orders. And we want to make sure we put on our gloves and make sure we don't get any of our oils on the outer part of the glove. And once we're ready, we can pull our label and grab our drugs. And before we put anything in our hood, in the IV hood, what we will want to do is make sure we have the right drugs, wipe them down. And our IV bag, wipe that down. And then we'll need to bring our supplies into our IV hood. So we have our drug and our diluent and our IV bag. We'll actually need to wipe off the caps to make sure that they are all sterile. With our drug order, we'll be pulling some diluent. So the amount of diluent we need to reconstitute the drug. And make sure we have no bubbles. So we need 10 milliliters, cap it, set aside our diluent, pull our drug, and now we will actually add the liquid to our drug. And what we'll need to do is we need to make sure we mix it together. And once our drug is mixed, we'll actually pull out the dose that we need. Once we have the dose we need, we'll be injecting it into our IV bag. Once the dose is in the IV bag, make sure we protect and seal it, made with tamper-proof covering. And we are set to send that to the patient, to be administered to the patient.
Hi, Kimmy. How are you feeling today?
Yeah, I feel much better today. I feel good. Yeah, but still a little some dizzy or sleepy feeling, but I think it will be gone sometime.
Yeah, that's normal. And it seems like since you're feeling better, the antibiotics have been working. So the plan is that we'll let you go home today.
Okay.
Do you have any questions at all?
And do I need to take some medication or should I come back sometime?
Yes, we're going to send you home with some antibiotics and some pain medications, okay?
Okay.
And then the plan is to have you follow up in the surgery clinic.
Okay. Okay.
Okay?
Yeah, so good. Yeah, I felt I almost having a baby or something.
Wow.
Oh my God, such a pain, but I feel so good.
Yeah, I'm glad you're feeling better.
Yeah, thank you. Wow. Thank you, everyone. I'm so happy. Pain free. Yeah, thank you.
All right, you just saw the fourth video. So this is the last chance to go ahead and make your points count. We're going to transition over back to Marita for Cahoots. Marita, back to you.
Okay, here we go. The last questions. So this is our last round. Get those questions answered quick because right now it's still anyone's game. Starting with there are 4 questions in this section. Kimi has an infection after surgery and a provider is worried about sepsis. What does sepsis mean? Okay, and the correct answer is chemicals released in the blood causing inflammation throughout the body. Look at that leaderboard. Oh, and Kentwood has moved into second place. Meadowdale in first, KW right behind in third. On to the second question. Why did the pharmacist look at Kimmy's kidney function before deciding the drug and dosage? There's more than one answer here. Ten seconds left. Okay, and the correct answer is if the kidneys aren't working properly, medications can build up and cause harm, and kidneys play a crucial role in eliminating medication from our bodies. Here's question 3. Oh, after the scoreboard. Meadowdale still in the lead, KW in second, Kentwood right behind. Let's go to question number 3. What are the benefits of delivering medications through IVs instead of the mouth? Again, more than one answer here. Five seconds. Okay, and the correct answers are all 4. More precise dosing, unlike pills that have predetermined dosing, able to store drugs, minerals, vitamins, and maintain hydration. Drug is delivered to the bloodstream and the drug's effects are immediate and allows for painless delivery of medication while pills can cause discomfort. Let's look at the leaderboard. Oh, it's moving around. Meadowdale's still in first, but Kentwood has moved back into second. Now for our last question in this round. How many healthcare professionals help treat Kimmy?
This one's a tough one. and all of that treatment, how many were part of her treatment team?
And the correct answer is 11. Great job. Let's look at those healthcare professionals. Patient access representative, medical assistant, provider and radiologist, surgeon, 2 lab assistants, CT tech, patient transporter, pharmacist, and pharmacy technician. Okay, now let's look. That's the end of all of our questions, the end of our game. Let's look and see who the winner is.
Third place.
KW, oops, sorry, James. KW in third place, Kentwood in second, and our winner is Meadowdale. Great job, everyone. Thanks for playing. Hope you enjoyed yourself. Back to you, James.
Hey, congratulations. Wow, what a fun game. Man, all of you did really well for paying attention to the video, answering the questions, and doing the competition. Man, great job. I remember just in the beginning of this session, we were talking to students about what they wanted to be. We have doctors, nurses, radiologists, all the different medical team that you saw there. And if you look at that, that really takes a team effort. So it's not just one person that helps treat a patient, it's a team of people. So that is the way the medical profession runs, and we are congratulating all of you for being winners in this. So congratulations to everyone. I am resharing my screen as well, so let's get a virtual round of applause for all the contestants. All right, great job. Originally, in our schedule, we did have that we were going to be taking a break, but because of some of the delays that we had with our video, we're going to continue moving on because we do have some of our guests with us here today. So we are excited. But just so you know, I am sharing my screen, and we're going to go ahead and start now with the individual career interviews. And what the first person that we've got here, and I'm going to go ahead and thank Marita and ask her to go off screen. But we're going to bring up Faye. And Faye, if you want to go ahead and turn on your video, this will show all the students, you and I talking. So Faye, come online. Great. Faye, how are you doing today? And you're on mute, Faye, just so you know. So go ahead and press your mute button there. It's on your lower left-hand corner, and that'll allow you to talk. Great. How are you doing
All
today?
right, can you hear me now? Thank
Yes.
you, James. Thanks for having me. Yeah, we got a very busy morning, but everything goes smoothly. Yes.
Terrific. Well, welcome. Well, Faye, we're excited for you to be here. And as you saw in the video, Faye was there last year, and some of the other people you're going to meet today in filming this video just for you, just for the students. So Faye, in this format, we've got 6 minutes total. 4 minutes are going to be with kind of that Q&A part. I do have some questions for you. And then the last part is the last 2 minutes, we are going to be taking questions from the students. So we do want to have some students. If you have questions for Faye, Faye is a medical assistant, but let's go ahead and get started with the interview. So Faye, the first question we have is, what inspired you to pursue a career in the medical industry?
First of all, it's the interest. I do love this medical field. And then always feel like the human body is the most amazing and fantastic, art. And I'm interested with that. I want to know some knowledge about that. And then the other part is I really enjoy to taking care of people. And also the health is the most basic and important thing in people's daily life. And if you can do something to help people improve their quality of their life, that feeling is amazing. And also medical industry is a very broad field, and it can give you many opportunities to find the area that you're interested with, you're good at, and then you can do some on that. And it's a long-term career, broad development space, and also variety positions. And the other important thing is when you do this job, the sense of accomplishment, the value added on yourself, that's amazing. Yeah.
Yeah. Now, Faye, how long have you been a medical assistant?
So now it's my third year.
Wow, that's
Yeah.
terrific, man. So thank you for all your support and helping all of us continue to be healthy. And your work is definitely important. All right, we've
Mm-hmm.
got the next question.
Yep.
What has been your academic journey to get you to your current profession? So what kind of coursework you had to take and, what is the rigor in that? Was that hard, easy? I mean, tell us about your academic journey to become a medical assistant.
So it because when I come to American like 6 years ago, in China, my major is like management, and I've never do this job before. It's all from the passions. I love it, and then English is my second language, and but I want to take this challenge. I want to see if I can make it. So I attend a medical assistant apprenticeship program, and all the um, mentors, the classmates give me a lot of support and they encourage me to keep going, keep going. Finally, I made it. Yeah,
Wow, that sounds
yeah,
exciting. And it sounds like you're really dedicated to the studies and your academic work. It
yeah.
sounds like it took a lot of intentional work.
Oh yeah, it needs a lot of effort, but if you believe you can make it, you can make it. Yeah, just put effort on that, and
Wow.
it's worth it. Yeah.
Oh, I really enjoy
Mm,
that phrase. If you think you can
yeah.
make it, you can make it. And I completely agree because
Yep.
we have students who want to go into the medical field and maybe they don't feel as, confident with themselves, but I really appreciate your phrase. If you
Mm-hmm.
think you can make it, you can make it. And I completely agree with that. All right, going on to the next question. So what do you enjoy most about your job? And then what do you think is the most challenging part about your job? So what do you like and what's the most challenging aspects of it?
The most enjoyable part, like I said, is the sense of accomplishment. Yes, when you're helping people, it feels like you do something for others, and also you contribute the values for yourself. And then in this field, it's kind of like you never stop learning. Every day you learn something new, and the skills, the knowledges, and also you can learn a lot from patients. When patients come to see you, and then they bring in their stories, and it kind of like give you the thought of how we can live well, how we can take good care of ourselves and our families.
Wow, thank you for that. Yeah, no,
Mm-hmm.
that sounds
Yeah.
like you definitely have the right
Mm-hmm.
passion to be in the medical field and you
Yeah.
continue learning. Being in the medical field, you're never stop learning, right? As
Oh
new
yeah.
things kind of advance, new advancements
Mm-hmm.
in the medical industry, it's always a learning process.
Definitely. Yeah.
Terrific. All right. Well, we are transitioning over to student questions. So,
Mm-hmm.
students, what questions do you have? If you want to go ahead and use that Q&A, what questions do you have for Faye? What would be something you would be interested in learning about the medical assistant role or something about Faye's journey? So go ahead and enter those questions into the Q&A and let's take a look at what you're coming up with. So in Faye's area, Faye, where do you want to take your career over the next 10 years?
I'm thinking of it's kind of like it's my third year now. Now the medical assistant job, um, actually, we can say it's a basic job, and we taking care of patients from the beginning, and there's a lot of detail works we need to do, and then after you're working more, you will feel like I want to do more. Like I wanna know, having more knowledge. I wanna have more skills so I can do more for people, for the I can support the providers better. So my future, I'm planning to uh, one is improve my language skill, and then I probably will start with a interpreter um, uh, course, and after that I plan to do the nursing. I hope I
Wow.
can make it. Yeah, it's hard, but I will make a try. Yeah.
Oh, Faye, you gave me goosebumps just talking about that.
Yeah.
You did, just talking about your motivation, your goal to become
Uh-huh.
a nurse. Faye, I
Yeah.
am really, really excited, and thank you so much for joining us today.
Thank
We really
you.
appreciate your time for making the
Yep.
video, for coming today and sharing your expertise with students. So we're going to move on, but thank you very much and good luck in nursing school. I
Thank
look forward to
you.
those
Thanks.
updates.
Yeah, thanks for having me. You have a good day.
All
Thank
right,
you,
you too.
everybody.
Bye-bye.
Bye.
We are transitioning over now to Tana. Tana, if you want to go ahead and come off camera and go ahead and show yourself on camera and unmute yourself, that would be appreciated. We're going to continue on. Tana is a pharmacy technician. And so Tana, go ahead and come on camera. Hi, Tana. How are you doing?
Good. How are you?
Perfect. Thank you so much for joining us today. We are excited for you to be with us. As you know, we do have high school students that are watching this streaming right now and are interested in your profession as a pharmacy technician. So, start out with those questions. What pursued you to pursue a career in the medical industry?
Most of my adult life, I have worked in healthcare, and I started out as actually a caregiver and then spent some time in California. And during that time, I worked as a mental health rehab specialist.
Wow.
And during that time, I was able to see what medication really truly could do for an individual in a positive way. So when I had the opportunity to move back to Washington, I decided to return to school and pursue a career as a pharmacy technician.
Wow. Sounds like an incredible story. So you really have this broad perspective kind of coming into the medical field. I mean, you've got the
Right.
behavioral health portion and now you have the medical portion. So what a really great way to kind of keep enhancing your skills. Can you talk a little bit about the academic journey? I mean, you talked about going back to school. What was that like
Yeah.
going back to school?
So when I decided to go back to school, I actually interviewed two different routes that I could go. A being going just to a technical school and just getting the process done quickly. And then the other was I did a lot of research on going to a community college that also had the program. And I chose to go that route because if I did want to move forward in a medical career, I'd be able to use those credits that I already earned and be able to move further ahead. Well, and just going to the technical school, all I could do was the technician side of it and not
Gotcha.
move further.
Yeah. Now, what was the rigor in that? Was that a easy kind of thing for you? You were kind of well versed. There took a lot of studying.
It does take a lot of studying, but it's definitely manageable. I was able to test out of some of the prereqs that were required, and it took a little over a year and a half. So it's not horrible. It just depends on your timing and if you can get all the classes that you're wanting to do.
Right, right. Wow. Talk a little bit about what you enjoy most about your job.
I would have to say the thing that I enjoy the most is working with the public and also on the behind scenes, working with the other, the team, the medical team that helps support us, the doctors, medical assistants, all of that group. And also it's a high paced job. So you're definitely keeping busy, but you also are having an opportunity to also work on your by yourself. I like the diversity of it.
Yeah, you mentioned something really important, and you mentioned teams. So working with other people. I mean, and I agree. Even looking at the videos, it takes a team of healthcare professionals to treat a patient. It's
It
not
really does.
typically just a one kind of person kind of thing, right? Can you talk
Right.
a little bit about the team part and what are the things that need to happen within a team to make that effective?
Just really good communication. As the years have gone by, there's been new tools that we use. Like we're able to use Teams messaging. And so if we have a question for one of our doctors, we can get to them quickly. So it makes it so there's not as long of a wait for the patient. We can help them quicker.
Okay. Wow. Your job sounds really exciting. One of the things that I wanted to do is allow students to see if they had any questions for Tana. If you have any questions for throughout any of these interviews, please go ahead and use that Q&A and put them in there. But Tana, I wondered if you could kind of talk a little bit about where you want to take your career over the next 10 years. I know you transitioned into a new career in healthcare. Is this where you want to be? Do you want to, what other areas are you looking at? Or, what's your expertise going to keep going?
So I have been a pharmacy technician for 10 years now. Before going into that role, every job prior, I was in management. So eventually I would like to see myself do management with pharmacy.
Okay. All right. Wow. Well, thank you, Tana. We really appreciate your time. Thank you so much for sharing your expertise with us. We're going to go and transition to our next interview, but good luck in your future, and we look forward to hearing some updates in the near future. So
yeah, thank you.
All right. Thank you very much. All right. Our next interview now is going over to Tammy. Tammy, I'm going to ask you to come off camera, unmute yourself, and we're going to start this interview process. So thank you so much for joining us. So now Tammy is a lab assistant. And Tammy, I see you on here. If you want to go ahead and show yourself on video, that would be helpful.
Trying.
Sure. Yep. It takes a little bit of time. I did ask you to start your video, just so you know. I'm not sure if that sends a request. But if needed, let's go ahead and see if we can get your video on camera. All right. There you go. I can see you just fine. How are you doing today, Tammy?
Yes. Hi.
Hi. Thank you. Thank you so much for joining us today. We've got a few questions to start out with. And just to let everybody know, Tammy is a lab assistant. Tammy, how long have you been doing your work, and what pursued you to get to join the medical industry?
I've been doing this for 24 years.
Wow.
Yes. And I've been at the same company. Well, we were Group Health before Kaiser bought us out. So that's the only place I've been.
That's cool.
I went into this field because I like helping people. I originally was a medical assistant, and my schooling consisted of medical assistant, phlebotomy, and EKG. But I prefer the phlebotomy part of it.
Why is
And
that?
I find that that's more because you're helping people a little more to me. I like the science behind the blood. So I'm sorry, I'm not very good at this.
No, you're doing a great job.
But I like helping and being able to interact with the patients a
Sure.
little more.
Okay, so you've been talking so positively about it. I want to know, what are the challenges, or what are the things that you like least about your job? I mean, give the students an inside look about what are some of the nuances or things that you have to kind of work through in order to be a successful lab assistant.
Doing children, that is the hardest one of all.
And
It
you
took
mean
me
by
2
taking
years.
you mean by taking their blood is what you're talking.
Yes.
Okay. Talk about that.
Venous draws. Heel pokes are easy to do once you've got that skill down, but doing a venous draw on a child can be very difficult at times because their veins are almost like a thread, a string of thread. They're very small. So, and the other challenging part of it is that they're always moving and wiggling, and the parents aren't always very firm and holding because they're afraid that, they're hurting their child. And in reality, we're not.
Right, and just for the students, so that they know, whenever you have a young, I'll say baby or kid, sometimes you have to take it through the heel
Yes.
of like an infant, or as Tammy's explaining, kind of with a little kid, their veins are very small. So geez. So Tammy, how confident are you now that with all your years of experience in doing blood draws? Or do you feel pretty confident when it all comes together and you're like, yep, I can
Oh,
do it?
yes.
Okay.
Oh, yes. And there's days, though, that we do have what I call a bad hair day, but where we get some that are very challenging. But usually if we have a hard time ourselves, then we get someone else to step in and see if maybe they get a better feel. Because as I teach all of our students here, you don't use your eyes. Your fingers are your eyes. And it's best to just kind of look off to another side and feel with your finger, and then you'll get that visual of what you're feeling for. It's a plump little sponge.
Wow, I did not know you don't use your eyes. That is new information for me.
No,
So I
you
have to
do
admit,
not.
whenever I get my blood drawn, I'm a little nervous. I don't like needles. It always makes me a little anxious. How do you deal with patients like me that are anxious?
We try to talk them through it all, come up with different conversations. If we can get something out of them that we have in common, or if you don't, you start talking about, well, what are your plans for the weekend, or do you have to go back to work after this? Just any way that you can possibly help ease them through it. And then also we've had some really needle phobics to where it does not matter what you say, what you do, you're just going to have to work your way through it.
Yes, I think
just got to do it.
I feel like you're talking about me. So So thank you so much, Tammy. We really appreciate your time and spending us here today. The students appreciate it, all the learning that is happening today. We are excited for that. So thank you, thank you, thank you very much for your expertise and sharing part of your story. We wish you lots of luck and good luck in the future. We look forward to some updates. All right, so we're gonna let go of Tammy and we're gonna come over to Dr. Carl. Tammy, you can go ahead and go off screen, and then Dr. Carl is on screen. So we're going to go ahead and interview Dr. Carl. Dr. Carl, how are you doing today?
I am doing great. Good morning, everyone.
Good morning. Can you talk a little bit about a radiologist? I know that when we think about physicians, I don't know if radiology always kind of comes to mind per se, but maybe some of the differences about being a radiologist.
Well, all radiologists are physicians first, and then we've either subspecialized or subspecialized further. So I was in the Army as what's called a general medical officer. We would now call them a family practitioner. Old term would be a general practitioner. I went on and did a residency in radiology. I did my first fellowship in nuclear medicine, and I did a second fellowship in interventional radiology, and I've been practicing for a long time, a little more than 50 years so far.
Wow, such an incredible journey. Now, you talk about the academics, and I know we've got some students here that we were talking to in the morning that want to be physicians. Can you talk about that academic journey? You know, how many years did it take? I know you talked about all these specializations, so obviously that's kind of on top of the becoming a physician. Just talk about that academic journey a little bit.
Well, I'm concerned that I would turn everybody off because after 12 years of grade school, middle school, high school, I took a year off to join the Army, 4 years of college, 4 years of medical school, 1 year of internship, 3 years of a residency, 2 years of a fellowship, another year of a fellowship. I think my youngest son says, "Oh my God, that's 27 years you spent studying." Well, actually about a third of it has been in actual practice with patients. So there's the academics, you got to get out of college, but even in medical school, we now start to see patients. So for me, seeing patients every day is the best part of my job.
Wow. You were mentioning earlier, we were talking about kind of women in becoming radiologists and just what that kind of offered people that were looking to have families or spend more time with their loved ones. Could you kind of unpack that a little bit for us?
I would be glad to. So in my department, I'm a minority. I'm an old white guy, and I am a minority in the department. More than half of the department is women of all over the world. And many women are drawn to radiology now because it gives them the opportunity to be moms as well as physicians and radiologists. So we have the opportunity for them to work from home 2, 3, sometimes even 4 days a week. So they can be at home with their families. As one of my colleagues says, oh, I love being at home. I can start a load of laundry, then I can do some radiology, then I can make lunch for my kids, then I can go back and do radiology. And so we really have adopted to the work from home model for, as I said, 2, 3, sometimes 4 days a week. And as a result, radiology is welcoming many, many women who have the opportunities to not only pursue a professional career, but also be moms at the same time. And they love it.
Yeah, so it sounds like anyone who's looking to kind of work more from home or kind of have that hybrid schedule, whether you're starting a family or you're looking to explore a little bit other areas in your life, you can definitely have that flexibility for working more a hybrid model. That's amazing. Dr. Carl, can you talk about what are the most challenging parts of your job?
Probably, so I do a lot of oncology or cancer imaging, and I do a lot of breast biopsies. And so the hardest part of my job is to tell a woman or a man that they have cancer.
Wow.
And then I usually say, but in our building, we have 400 people who are here to take care of you, and you will do well. So the hardest part is letting them know the initial diagnosis. The best part is most of them, many of them, will survive, live, and do well. And we have a whole group of people in our building to take care of them.
Wow. Now you mentioned that you've been in the profession for quite some time. I know you said you're a seasoned professional. What has changed, over that course from where you started and what you do now in the same line of work, but what has been the advances in using technology or anything else?
So in medicine, when I started in my medical school class of 120, there was one woman. Now medical school classes are 60%, sometimes more women. And again, the profession allows them to be moms and have a professional career as well. So I think the greatest change has been, I'm going to say the gender, the ethnicity of medicine in general, and all for the good. Okay, vastly better now than when it was almost an all male profession.
Gotcha. So yeah, so the opportunities for women has kind of expanded, and obviously, as Dr. Carl is sharing, that majority of some of those schools are filled with women and mixed with men. And once again, I think in this profession, you have the flexibility to work more in a hybrid model and something you can do from home and from work. So, Dr. Carl, thank you so much for your time. We really appreciate it, and I really enjoyed seeing you in the video last year, and then coming back again today to share an update. Thank you, thank you, thank you, and we wish you lots of luck in the future.
It's been my pleasure. Thank you now.
All right. Next, we're moving on to Dr. Thomas. Dr. Thomas, if you want to come off of mute and come onto the screen, go ahead and press your unmute button. There you go.
Hey, Dr. Carl.
Hey, Dr. Thomas, how are you doing?
I'm good. I just, it's a pleasure to also see Dr. Carl, who I worked with years ago in Tacoma before he moved to Bellevue.
All right. Well, terrific. Well, Dr. Thomas, what we want to know is what inspired you to become a physician? And if you could talk a little bit about being an internal medicine hospitalist, just what that really means for our students, to understand that.
And maybe I can loop in that question about the educational journey, because I think that's really tied in my mind. So when I was in elementary school and middle school, I wanted to be an astronaut. That was really driven by a movie that I saw that I was like, I love that movie. I want to be an astronaut too. And so I said, okay, I better be good at math, and I better be good at science. And I was really interested in those fields, astronomy in particular. When I got to high school, I kept exploring biology as a science, but I didn't want to be a doctor. And I was having a lot of fun playing the trombone, being in the United Nations Club, and learning Japanese. And I studied abroad in Japan. So then I took a year off. I worked in the Caribbean. I did volunteer work with a lot of kids and communities in a rural area. and thought about, you know, my dream to be an astronaut, and thought maybe that's not so useful for people like the people here in this really small village. And I went to a historically Black college, and I said, okay, I'm gonna do this thing, medicine, you know. But it wasn't like a foregone conclusion. It was like, okay, if I really love the science, I took that biology class, you know, my first year in high school, and I loved it. And I took a biology class, you know, my first year in college, and I did really well. And I love people. You know, I spent a year between high school and college and just was with people. I thought, you know, I love people, and I want to be also of service in the best way possible to community, to all humanity. And so I said, yeah, this medicine thing sounds like a good deal. As long as I can do it, as long as I can also do it with public health, so I can take care of communities. And I'd really like to study some more Chinese and traditional Chinese medicine. So as soon as I decided I wanted to be a doctor, I also decided I wanted to go to China. And 3 months later, I was studying Chinese language, traditional Chinese medicine, like acupuncture and so on. And then I went to med school. I had all those interests still, focused on pediatrics, internal medicine, and then finally in residency, said, you know, I have a lot of older people in my community who I really want to make sure I can take care of those old people. You know, my relatives and other people, especially in Black communities where we don't have a lot of doctors and we have a lot of illness. And so I said, you know, I need to do this. I need to focus on the old people, so internal medicine. And I just got really interested in good at taking care of people when they're really sick. And also what you saw today was a little bit of my role. So you saw Dr. Brenda talking to the patient after she was actually admitted to the hospital. So that role would have been my role, talking to her, ordering the IV Zosyn, which I got to see mixed for the first time in my life. I'd never been inside the pharmacy lab world, but that's a medication that I could be ordering today here at St. Joe's in Tacoma is Zosyn. And, you know, talking to the radiologist, I get to interact with the surgeons, and then I get to talk to patients about how to stay out of the hospital, and give some advice about that. If I hadn't done this, next best thing would have been working in the clinics, and talking to patients about their long-term health and trying to keep a whole, like a panel of maybe 1,000 or 2,000 people healthy enough to stay out of the hospital. And if I wasn't a doctor, I would be a teacher.
Wow. So you have a lot of interest. I mean, astronaut, teacher, physician, you talked about acupuncturist. I mean, you have a lot of different experiences here, you know, and you talk so positively about it, which I really appreciate it. But what I want the students to understand is, what are the most challenging part of your jobs? What are the things that are not as fun and glamorous?
Yeah, you know, I'll be really honest. I'll give you two of them. One of them is social injustices. And social injustices really impact us because we deal with the consequences in healthcare of problems that are like racism or poverty, that are problems of the entire society. And it can be really hard because at the end of the day, we take care of everyone when they fall down and get sick. But when we keep seeing the same things causing people to get sick, and they're rooted in social injustice, that can be really frustrating, and that drives a lot of us to really want to study those things and do things like showing up to a school board meeting or showing up to you know, talk to members of the in Olympia and trying to help people to deal with that. So I'd say that's the biggest one. And then part of that too is it's related, is just dealing with change within the healthcare. This is actually not related, but dealing with change in the healthcare system, because healthcare is a really rapidly changing field, and it can be painful, not just hard, but painful, keeping up with the changes.
Yeah, thank you for saying that. I think, you know, you talking about changes really highlights a lot of the themes that we heard from the other panelists. It's just about that, all the things that are changing. And I will say, you know, healthcare changes all the time with advances, with the communities, with the populations, the needs that are happening. We saw that during COVID pandemic as well. And so thank you for all of your support in that. All right. Well, Dr. Thomas is actually going to be part of our professional panelists. I want to thank you for your time for the individual part. Dr. Thomas, if you want to go off camera, thank you very much. We are going to transition over to to our industry panel here, and I'm going to share my screen just briefly. Just highlight the individuals that are going to be part of that discussion. It's going to be led by our own Frankie from Seattle Jobs Initiative as the facilitator. And our special guest we have today, we have Cassandra coming from Sound. She is the Regional Director of South, and this is our behavioral health representative. In addition, we have Marita, who you saw earlier from Children's Hospital. She is a workforce planning consultant, and including Angie from Kaiser Permanente, a Senior Director, Talent Strategy and Acquisition, and including Dr. Thomas, who we just saw here, once again, an internal medicine hospitalist. So I'm going to ask all 5 of you to come off camera and come and show yourself. Go ahead and unmute yourself. And I'm going to show myself off video, but we do have our facilitators here. And we've got Frankie that's going to help lead this discussion. And Frankie, if you want to come off camera as well, that would be terrific. And we've got people here who are going to lead you through a discussion about the industry, about healthcare, and really kind of what that looks like in that way as well. Cassandra, if you want to go and show yourself on screen, we'll see you here into the gallery.
You've stopped my video, so.
Gotcha. So I just said ask to start video. So let's see if that kind of puts you back in. So
Yes, it does.
Perfect. All right. Well, I'm going to hand this over to Frankie. Frankie, over to you.
Awesome. Thank you so much, James. Well, welcome to all of our panelists. Thank you for being here, and we are so excited to hear from you. And again, my name is Frankie Rowe with Seattle Jobs Initiative, Director of Healthcare Pathways. And we are going to get started with a few questions that I will ask you all to answer. And we have a few questions. We may only get through a few today, but I am excited to hear from each one of you. So we're going to start with Angie, and then we'll hand it over to Marita, if that is okay. And the first question is, how would employees describe your organization?
Thanks, Frankie. Hi, everyone. It's so good to be with you here today. So Kaiser Permanente is a multifaceted organization. I think that's probably the best way to describe us. We provide care, as you'll hear from Dr. Thomas. We also are a health plan, so we're an insurance provider. And so there's a lot of jobs that come within that scope that are jobs that you might not think about in the healthcare space. So that's we have a great opportunity to provide a lot of different kinds of career growth opportunities. We're a nationwide organization. However, I'm here today representing our Washington region, which is KP Washington. Used to be Group Health years ago. Some of your parents might know or remember Group Health. Yeah, so super excited to be here. And I think for us, as far as our organization goes, it's really all about so many kinds of career opportunities and ways to join and support our communities through providing healthcare.
Awesome. Thank you so much. And I believe we'll hear from Marita.
Thank you, Frankie. I think that we would describe children's, for one, we're a children's hospital. We deliver compassionate care to children and adults young adults up to age 21, regardless of their ability to pay. We're at the forefront of medical research. We cover Washington, Alaska, Montana, and Idaho. And just our organization lives by our values each day, which are compassion, excellence, integrity, collaboration, and equity, and innovation. Our workforce, our organization really values our workforce, and focuses on, helping us develop and helping us grow, to become a place that everybody wants to go to work each day. So they continuously foster an environment of inclusivity and belonging. We value the diversity of our workforce, and we also we value our community, and we show that through different programs that we offer. We do mobile vaccination clinics at different schools, and then engaging with high schools like the ones that are here today. And also just an organization that's really focused on health equity and doing what we can to move that needle forward and create an equitable healthcare system within our state, but also just within Seattle Children's.
Awesome. Thank you, Marita. And Cassandra, tell us a little bit about sound.
Okay, good afternoon. Oh, it's still morning. I'm sorry. Good morning, everyone. I am the South Region Director here at Sound, and Sound is a behavioral health organization. We provide mental health services as well as substance use services. Also with that, we provide domestic violence services, and we provide services from what we call the lifespan. Very small children, 4 and 5 years old, all the way up to older adults. So throughout the lifespan. And our goal is to help everyone in their journey on recovery from substances and from mental health diagnoses. And so we believe recovery happens here. It's a mission that I believe in very strongly. I've been at Sound 29 years. And many of my team members and some of our staff have been here that long because we believe in the mission and the services that Sound provide. We are the largest provider of behavioral health services in King County, and we serve individuals from the Pierce County line all the way up to the Snohomish County line, from the Puget Sound to the mountains. So we have a wide spread of geography that we serve individuals. And Sound, because we're such a large organization, there are many careers at Sound that are not just therapists or case managers, because we have to have our back office and what we call our operational support staff, HR, payroll, all of those things need to happen here at Sound so that so the clinicians can do their job and serve the clients well.
Awesome. Thank you, Cassandra. And so for our students out there, we will, after our panel discussions, we will give you the ability to ask some questions. And so with that, you can ask those in the Q&A, and our very own James will ask the panel those questions, okay? So moving right along, I know that we have a few folks here from Kaiser. Is there anything that someone from Kaiser may have missed where you may want to answer that question? How would someone describe your organization?
Yeah, I'm happy to
go ahead. Go ahead, Dr. T.
compliment. So we are two organizations that are married in a happy marriage, the insurance and business side and the medical group. And I think a lot of us in the medical group are so happy to be connected with the insurance side, because what that allows us to do, and this is something you all may not have realized is a downside of medicine that we're not falling into, but we're actually able not to pay attention to therapies, medicines, and surgeries that really are used to get money, because there's a lot of money in healthcare. And unfortunately, the way the system is designed, it can really be tempting for physicians to do things to get more money. Like a classmate of mine who became a cardiologist in Chicago, and he felt he had to do a whole lot of these procedures that patients didn't need because he had this pressure to do these procedures to get more money for his team. And we don't have that. We just have members who take our insurance, buy our insurance, and we look at them as a whole population, and we can say, what would be an innovation that would benefit this, us as a population, as a community, and how could we keep people as healthy as possible, and focus not on that profit motive, but really on the best science that can help people live long and healthy lives.
Wonderful. Thank you for sharing that, Dr. Thomas. And we are going to move on to our next question. And before we move on to our next question, I want everyone that is here to think for just a second with the theme that we have, which is Imagine a Future in Healthcare. Each one of you had the opportunity to imagine a future in healthcare. So students, as you think about the way that our panels are asking the question, how does that stir up your imagination to want to be a health care provider? So with that, I'm going to ask our second question, which is, what advice do you have for high school students interested in pursuing careers in healthcare? And let's start with Angie.
All right, thanks, Frankie. So I would say, take the opportunity to do things like what you're doing today. So be curious, talk to, your doctor when you go to the doctor, talk to anybody that you know or that your parents know who might be in the field in any aspect of the field. Think about and it kind of getting back to imagining, imagine yourself, like, so when you see things like today and the various videos and you're able to talk to folks about it, really kind of envision yourself in that role and think about what that might feel like to you, as you might be able to ease someone else's way to help them feel better in their life. So do the research, ask a lot of questions, participate in opportunities like you've been able to today. And for those of you who might have been able to attend the in-person event as well, just be curious and ask a lot of questions, because that's what folks like myself and the panel here are for, is to answer those questions and help you get the information you need.
Awesome. And Angie, I have a follow-up question for you, because a lot of times when we think about healthcare, we think about the doctors, the nurses. What makes your role so unique and important for healthcare?
Thanks, Frankie. So I have what I think is the most amazing healthcare role, and that is actually being able to help other people move into this industry and discover it as their calling and as their career. It's something that it's a personal, motivator and around for each individual as far as what they want to do. And I love helping people find that spark and that ability to think about themselves in a career and think that might be their future. For me, I get to welcome people into the organization. I get to reach out, and try to convince them to come work at Kaiser, whether it's in the health plan side or the care provider side. And that to me is just really exciting, because it helps people. It's helped improving our community by finding people good payable job, good income positions. It also helps the organization, because we're welcoming amazing people who are there and committed to the same mission we are, which is being able to improve the health of our communities. So anyway, so I love my job. And I think a lot of times people end up in recruiting. Marita, I know, can speak to this too. And, the fact that I get to, help people find their passion while helping a great organization better our communities across the country, to me, that's just, I love it. Anybody interested in HR, I am more than willing to have conversations with anybody. I'm super passionate about it, and you could be too.
Thank you so much, Angie. And then next, I'm going to call on Dr. Thomas and ask the same question. What advice do you have for high school students interested in pursuing a career in healthcare?
Yeah, well, I put something in the link, and if I'm able to share screen, I can also answer that question a little bit better because my team just went through an exercise of listing all the careers that require a higher education beyond a bachelor's. But I think look at everything, look at every corner of healthcare, and don't settle too soon on one path. Like Angie said, be curious. There's just so much, and consider us as maybe we're like the recruiters to different college sports teams, and all of you are these great athletes. You don't have to go to the first school that comes to you. You know, I mean, there's so many different careers. Am I able to just share this list? Would that be okay?
I'm not sure, James, does Dr. Thomas have the ability to share screen?
Not in this session, Dr. Thomas. Sorry about
Okay.
that.
Well, I put into the chat explorehealthcareers.org, and I love this site because you have a list right there. What I would say is, okay, you know that I'm a doctor, but what do you know about naturopathic medicine, nursing practice, psychiatric nurse practice, family nursing practice, medical genetics, midwifery, optometry, pharmacy, physician assistants, podiatry, chiropractic medicines, orthotics and prosthetics, physical therapy, occupational therapy, speech therapy, and of course, health administration, the people who run the whole thing, and public health careers too. So there is just so much to do and learn as broadly as you can.
Awesome. Thank you, Dr. Thomas. And so, Cassandra, we'd love to hear from you on what advice would you give to high school students pursuing a career in healthcare, and especially in the behavioral health field?
I agree with my fellow panelists, is to be inquisitive and devote to being a lifelong learner, because your career is not a destination, it's a journey. And I say that because my journey to behavioral health was kind of circuitous, because many years ago, the high school I went to in the far South, deep South, they offered psychology as a course for us seniors. And I took the course, and I joined the psychology club. And it was very interesting, and I did that. But when it was time to go off to college, I was like, well, I need a career in the health field. Well, for a minute, I had considered nursing, but that was the candy striper. I don't know if they still have candy stripers. I tried the candy stripers, but the nuns were running the candy stripers. And that just like, oh no, I can't do that. And so I decided I would become a physical therapy major. So I went to college as a physical therapy major and got to college and was like, after a year or two, that didn't quite fit who I was. And I realized, because psych was my minor, that psych fit me best and that it was my calling and my passion. So just because you try something one time does not mean that you can't say, oh, this is not quite me. Let me stop and let me do something different. And of course, psych and behavioral health has been my passion. And so I got my BS in psychology and my master's in rehab counseling, a master's of education, so I could also teach. And one of the things I do in my current role is that I am part of training the next generation of clinicians that come to our organization. So that's one of the things I do in my role as a director manager. So there's lots of things to do in the healthcare. I would say be inquisitive, try things on, ask lots of questions, and be a lifelong learner in your journey.
Thank you so much, Cassandra. And Marita, please tell us your journey as well is not a typical role that you would see in healthcare, at least maybe 10, 15 years ago. So give some advice to our career students or to our high school students about a healthcare career journey as far as workforce development and planning and all of those good things go?
Absolutely. I think first I want to say that our theme is imagine yourself in a role in healthcare. And I really believe that if you just dream, whatever your dream is, first of all, don't let anybody tell you can't do it. Try not to let any barriers stop you from doing it. And talk about your dreams, talk about your goals, because that one helps hold you accountable. Because as you talk to other people about it, they're going to remind you, and that will hold you accountable to doing what you need to do. I really believe that you get what you focus on. And I always think about that. That's something that's always in the back of my mind, is you get what you focus on. I didn't think about a career in healthcare, although when I think back, some of my favorite shows I watched were ER. I watched Chicago Med every week. So there was an interest in healthcare there, but I am not a person that, although I love helping people, personally, I don't do well with giving bad news. I don't do well with when I see somebody that's hurt. I think I go overboard on the empathy. And so I realized that was probably not, a clinical facing role was not best for me. But I started out in recruitment, and that was because, as Angie spoke to, it was wanting to help others reach their dreams, wanting to show them an opportunity that they never dreamed of, that they could be a part of an organization or be in a certain role, and helping them get there, coaching them along the way, and advocating on their behalf to get them into those roles, but especially those entry-level roles. And that's what I did. I started out in recruitment. But then I found out that, I wanted to do more. So once I've got them into those positions, then I want them to feel that sense of inclusivity. I want them to feel like they're developing and they're growing. And that's where the workforce development came in, was I get the opportunity to not only work out in the community with, like the students we're here with today, but also I get to work with internal partners to build those ladders and pathways so that our employees, our workforce, know how can they move up from their role? How can they start in an entry-level role and end up being a registered nurse? How can they move in different, that's more of a pathway. How can they move in different pathways? Maybe they start out in this entry-level role, but this is where they find that they want to be. And then my role, even though I'm not patient-facing, is so very important to our organization as a whole and to healthcare, because without our workforce, then we wouldn't be able to care for our patients. And without our workforce growing and developing, then they wouldn't be able to have that continual care that we're able to provide for them. With, we've got some of our workforce members have been here 30 plus years. And that's because they've grown throughout the organization. And that's my intention. And that's what I like to help people do.
Awesome. Thank you. So I want to pause right here for just a second, and I want to share with the students that you have different roles within the hospital, and each one of them, though different, is important and valuable and will give you the ability to live out your dreams in healthcare. And we are getting ready to come up on questions. So I want you to start thinking about a question that you may have for a physician, a person who works in workforce, a person in HR, a person who's doing the behavioral health, and what that could be for you. Remember, we're in our imagination state. So this gives you the ability to imagine yourself in that role. It's not that far away. And I have one last question for our panelists. And while our students are thinking of those questions, I will ask you this final question, and maybe not all of you will get an opportunity to answer it. But if you could, maybe you could drop your answer in the chat. And so our last question is, are there any emerging areas within the industry that students should keep an eye on? And so I'm going to start this out with Cassandra.
Okay. One of the most emerging areas in my field are individuals who have lived experience And so that's a peer position who have had their own recovery journeys, and they choose to give back to the community that helped them, and they become a peer. So that is an emerging field or position or trend in our industry. Also, what's becoming more prevalent is those individuals who are co-occurring clinicians who are trained in substance use as well as mental health, and they bring both of those learnings to the table to assist their clients. I would say those are the two most emerging trends in our field.
Awesome. Thank you so much, Cassandra. And then how about Angie? What is emerging in HR and talent acquisition?
Yeah, you bet. Well, I'll say in healthcare and some of the things that we are, seeing as far as new roles that we're starting to recruit more in our space. There's a lot of development and evolution in the technology space, which is another area that I think people don't always think about. These big hospitals and health systems have to have the technology behind it, whether it's medical records, whether it's combining data, analyzing data to develop trends and health that it helps them come up with potential solutions that might be society-wide based on those trends. So clinical technology is a big one. Some of the other things that we've seen over post-COVID, there's a lot of work in overall community health. And understanding kind of the liaison piece between the different aspects of health. So how a person might go on a journey from when they first are ill to going into the hospital to the follow-up care to being cared for at home to then eventually going back to preventive care. And there's a lot of work that's happening to help people along in their journey through community resources. So that's another area that I've seen emerging in the healthcare space for sure.
Awesome. Thank you. And Dr. Thomas, you'll be the last one to answer this question for us, and then I will hand it off to James. So Dr. Thomas, what is emerging in your field?
The understanding of how social factors like racism impact health and what clinicians' responsibility is to understand and address those is something that we are woefully late in understanding and focusing on. It's been obviously something that's always been a factor, but it has not been something we've quickly picked up. And I've seen a lot of momentum recently in clinicians and health systems endorsing statements that really work on anti-racism. And I think that's a growing trend and an important trend.
Awesome. Thank you so much. Well, I personally wanted to say thank you to our panelists and for all of this rich discussion that we are having. One of the things that I do in my role is I remind our participants when they come into our program that they are wanted and that they are needed in the healthcare industry. So I want to say thank you to all of you for your work and your service. And for the students, if you are considering a career in healthcare, this is the perfect opportunity for you to ask questions and to learn more about what these amazing folks do day to day. James?
Terrific. Thank you, Frankie. Such a wonderful job, and thank you to all the panelists. A few questions that we had coming in is really about COVID and the pandemic that we recently experienced globally. As we know, this was something that, it changed all of our lives. And really, when we think about healthcare, how did your job or field change post-COVID, and how did it stay the same? So I'm going to just open that up. Marita, we can start with you and then go to Cassandra. Thinking about COVID, how did that change? How does the work change post-COVID, and how did it stay the same?
Sure. I think the majority of my work, my daily work, has stayed the same. But what's really changed is the fact that we're not in a full in-person environment anymore. So I work remotely. I only go in twice a month into our headquarters downtown. So the rest of the time I'm working remotely from home. And that can be a bit of a challenge just because you don't have that interaction with your team. I think my team does a great job of doing the best that we can, but you know, we're not getting that on a daily basis. And I think although it's working well for me, and I think one of the interviews talked about that, being able to do the things I need to do for my family as well. But then at the same time, you know, I have a lot of meetings. So that's one thing I would say was really changed, as well as more meetings and a little bit harder to get the work done because you're in meetings all day long. So although it's nice to see people on Zoom, but that's what I would say has changed for me.
Yeah, and it's kind of indicative of kind of this session that we have here that's happening virtually as well, right? Where maybe, you know, pre-COVID, we would have been doing it more in person. So yeah, Cassandra, back over to you in behavioral health. I mean, I can only think of behavioral health. I mean, I think of counseling, I think of treatment, I think of all those engaging needs that have to happen in person. I know that I've seen some things kind of like telehealth kind of come online a little bit. So talk a little about, you know, post-COVID, how has that changed in your area?
Well, I can tell you it's changed tremendously. Pre-COVID, we did very, very little telehealth, very little.
Wow.
And we had to spring into action when COVID happened to increasing our telehealth capacity and the service we offered phenomenally. And since COVID has abated, and I won't say it ended because we're still dealing with that, but it's kind of abated where it's more of a chronic condition as opposed to acute. We are doing hybrid because actually our clients, many of them said they did not like the telehealth environment. So we try to meet the needs of our clients and meet them where they're at. Those that like in-person service or prefer that, we provide in-person care. And those who would prefer telehealth, we do provide telehealth sessions. So we're doing hybrid since COVID has abated. And we probably do, I won't give a percentage because I may be totally off, but we do way more telehealth than we did pre-COVID. But we're still doing a lot of in-person services.
Terrific. Yeah. And I think to kind of have that impact with patients, sometimes that in person obviously helps that process kind of move along further. Terrific. Let's go to Angie and then to Dr. Thomas. Angie, how has COVID kind of changed your work area?
Yeah, so I think similar to Marita, everything is at home now, and it's all about Zoom calls from a hiring and interviewing perspective. There's a lot of virtual interviews for any of the roles like mine, where you aren't interacting necessarily every day with patients. I would say on the caregiving side, though, I mean, there weren't as many changes because our patients, are still they still need to be seen in person. And there was a little bit of a lag during COVID, but I think, and Dr. Thomas will be able to speak to this, for the most part, patients are back to in-person visits and things like that. But from a recruiting side, we definitely had to pivot to learn how to do virtual interviews and how to teach our hiring managers, so the people who are who make those hiring decisions, teach them how to interview in a virtual environment. And I think it's been a journey too for candidates who maybe were used to dropping a resume off in person, or doing some of these other things in person that really just don't happen anymore. Everything's kind of through a system and virtual. So I would say that would be probably the biggest shift for us post-COVID.
Terrific. Thank you. Yeah, just a different perspective on kind of talent acquisition and how we're kind of bringing in more people into the field. So, Dr. Thomas, you have a really interesting role. I mean, I think, Cassandra, I think, works with patients in person. You as a internal medicine hospitalist, I'm envisioning some things that happen virtually, but I imagine majority of it is in person, you know, if
Yeah.
you're at the hospital. I mean, how has that changed your work?
Yeah, we always still showed up to work, so there was never a change on that. But patients' families couldn't, and that had a huge impact on a sense of well-being that patients had in the hospital, the ability to communicate the patients with their families, and our ability to communicate with families who couldn't be there in person.
Right.
I think that it also disrupted our nursing significantly because I think we saw that the nursing field went through this huge change where people started to do traveling, and if one place, um, you know, paid a little bit more for a traveler, then they would just move from place to place. And so what we used to have was more stability, and nurses really knew the patients over several days, and we knew the nurses, over several years. And so we kind of had a working relationship, and you like to have that when you go in and you're taking care of sick people. And now what we're seeing a lot more of is people who have traveled in and are taking care of people with us in the hospital just for a short period of time. And it's really hard because you can't like connect and talk about your families, and you don't form those same bonds as prior.
Wow. So yeah, it's amazing how the pandemic has really changed all of our work and even the students. I mean, the students kind of watching this video feed here, COVID has obviously changed a lot of things, as you know, that we're doing this online and doing this virtually. We do have a question that came in about diverse backgrounds, and the question is, what is the need for healthcare professionals from diverse backgrounds? Why is it important to have diverse representation in healthcare? And Cassandra, let's go to you in behavioral health because you definitely have a really unique perspective in that. Why does diverse backgrounds, matter in your area?
Well, it matters significantly for the individual client. We are all about client voice, client choice. And sometimes you come in for therapy and you want to talk about some of your most personal issues. And sometimes clients say, I want to talk to someone that looks like me. I want somebody who understands or who might have an understanding of my struggles, of my situation, especially we serve a very diverse population here at Sound. We serve people who are native born, and we serve people who have immigrated to this country. And so consequently, sometimes people want someone to talk to, and we're supposed to be that objective place with unconditional positive regard where we can hear the person's trauma, their struggles, and the issues that they need to work through. And sometimes it's helpful for that person to look like them and have some understanding. Now, again, it depends on the client because some clients don't want that either. They want to talk to someone who's not related to their background because sometimes communities are very small here in the Pacific Northwest. And so that's their thought, oh no, you're in my community, I can't talk to you. So it's really about what the client wants.
Yeah. Dr. Thomas, back over to you, kind of with that bedside care. I mean, why does diversity matter in healthcare?
It matters so much that I think the question is, how did we ever think it didn't? So I like to flip the question on its head. I mentioned that I spent time in China. I went there 4 times for long periods of time and studied and was at the point where I was learning really to communicate about medical issues in Chinese because I was learning Chinese medicine. And I got to a point in my 4th year of medical school where I realized that I could really keep going, but on that route, I could really get good at that. But at the end of the day, I couldn't really, I wasn't part of that community at all. I wasn't, I would never have nuance understanding at all. And that was very different than when I was in Chicago and was actually witnessing racism and experiencing racism towards patients of African descent. So yeah, I just had so many instances where I was like, wow, like this is really happening because of an issue of race. So I'll just tell you one example was a guy who had a mass in his armpit. He was my age, like late 20s. He was Black, and he had already had 2 biopsies that were done the wrong way. And I was in a room full of doctors who were talking about him and how he needed to get another biopsy because they knew he had some kind of a cancer, but they couldn't convince him to do it. And he wasn't even my patient, but I went and I talked to him, and I just sat and I talked to him, and I legitimized the medical need was real. He really did have this. I wasn't on the team that had ordered the wrong procedure. It was a nuance that like they should have known, but they didn't. So I said, yeah, I'm sorry that happened. That was an error. And yet we are really convinced, and I am convinced, you do really need this procedure for us to actually know what's going on. And so he went up, he did it. And that has happened hundreds of times. I have so many experiences, even if patients are not Black, but they are brown, indigenous, where because I have an understanding of racism through the lens of being an African American, I could just understand them better. So that really is how I think about it in a personal sense, that, it's more of the question of how could we ever think that we could take care of people from every background without diversity ourselves?
Right. No, really good point. And, when we think about diversity, we also think of the onion, right? Kind of the different layers that kind of come out, because there's those that are frontward presenting, and then there are those that make our personal story. So, Angie, I want to go over to you a little bit because, when I think about that talent acquisition from a regional perspective, and even your support with such a large national organization like Kaiser Permanente, how do you, what are the things that you implement to ensure that you're, one is, reaching diverse populations, and then what does that look like with that talent acquisition?
Yeah, thanks, James. It is, first of all, I'll say it's at the core of, all of our work as we are attracting talent and finding talent to the organization. To Dr. Thomas's point, it's critical that we are able to provide healthcare to people and meet them where they are, and understand what their needs, both spoken and unspoken, might be. And sometimes that's difficult if you don't share a similar background or similar history. And so from an activity perspective, we do a lot of work with community organizations. So we work with a number of, whether it's a specific diverse background organization, whether it's a workforce development organization, similar to some of the ones that are here today and represented today, to ensure that, we are providing and showing folks what the opportunities might look like, and attracting folks into our into our organization where we might have current gaps, because we all know, there's systemic challenges and problems, frankly, that we are still trying to solve when it comes to ensuring that there's equity and in everything from opportunity to pay. For people that are currently working for organizations. So it's multifaceted. I think it's probably the best answer, but there's a lot of great partners that we do work with in our communities and schools to help us all reach the goal of creating more equitable workplace.
Yeah, Angie, one of the things that came out when you were talking was understanding that, one person or one group cannot be all things to all people. So you've got to keeping the diversity of that expertise within the organization so that you can potentially understand and obviously have that empathetic understanding of how to treat diverse populations. So thank you for that. All right, I've got one question for all of you, and I'd like for you to give me the 2 things that you do for self-care, because you're in it, you're in the profession, you know, we've got children, we've got Kaiser, we have sound, and you're in it in different facets. But one of the things that we do talk about with students is self-care, because you're in such a giving role, you're there helping people, you're putting out your energy, and I appreciate that. But what are the two things that you do to take care of yourself? So, Marita, let's start with you, and then we'll go with Dr. Thomas.
I think one of the things is making sure that, and I've had to be better at this recently, is taking those breaks during the day, taking time to get up and stretch, go for a walk, especially when the weather's nice. Just taking some time to sit back. I can share an example real quickly of, I had created this Excel sheet from a big meeting I was in, and my computer ate it and I couldn't find it anywhere. And I couldn't remember one single thing about that conversation. And I was getting so stressed out. And so I just got up, I left my computer, I went, got a cup of coffee, took a few minutes. It was okay to take that time. And when I came back, all of a sudden it started flowing. So I let that stress reside, and then I was able to come back and do what I needed to do. And I think just, you know, giving your team grace, you know, giving each other grace, and giving yourself grace. There's just times you need that.
Yeah, really good feedback. Thank you for that. Dr. Thomas, and then we'll go to Angie. You're on mute, Dr. Thomas, just so you know.
Yeah, I love getting out and going for walks. I love just kind of working out. I'm not as good at it as I need to be, and I'm constantly being reminded of that. But it's one thing I do. And then I'm also I also have some spiritual disciplines, and that includes reading from literature. I consider holy, so from sacred writings of different religions. It includes meditation on those, and thinking about how to apply those truths to my life. And it involves praying that I can be better. So I think those two are the kind of the big things for me. So yeah, thanks for that question.
No, thank you. Thank you for sharing that. Yeah, no, there's a lot of things to do for self-care. And I think, you know, as we kind of expand in our work, I think those change as well over time. Angie, and then we'll end with Cassandra.
Yeah, so I think as I have grown in my career, I've definitely gotten better at this as well, because it is not easy to do when you have so many things you're trying to juggle. But the two things that come immediately to mind for me is connecting with family. Personally, I have a son who just graduated from college, but now he's working for the college in North Dakota, which is really far away. And for me, that being able to reach out to him and connect is kind of my individual kind of healing. The other thing that works for me, and it might not work for everyone, but I am a musician in my background, classical musician, and so music to me is an escape, and I really do rely on that. Sometimes my neighbors don't like how loud I rely on it sometimes, maybe, but that's a big healer for me as well. So those are the two things that I focus on.
Yeah, connecting with family, and then obviously hearing that music. So,
yeah.
All right, Cassandra, wrap us up. What are the last things that you do for self-care?
Well, you know, especially in behavioral health, we absorb so much of people's stories and their trauma, and you have to find a way to get away from it and not personalize it. So being able to set boundaries is very crucial in my industry between your work and your personal life. And I'm pretty good at that. But in my personal life, I do love to travel and get away. And I love to do that. I will do it solo, but I will also do it with friends. But I have things like, you know, the typical things that a lot of people do, the dog, the plants, walking, all of those kind of things that give me joy. Those are kind of things. And I love laughter, because I don't think we have enough laughter in this world. So I can watch a mindless comedy and be taken away from it, because I think we need to laugh more and smile more.
All right. Well, I want to thank all of you for joining us today and sharing your expertise, especially about how self-care matters for you, because that is important. And thank you, thank you, thank you for all of your services. Let's give a virtual round of applause for our panel experts. We really appreciate that. Thank you very much, and we appreciate you. I'm going to go ahead and ask all of you to go off camera, but thank you so much for joining, and we appreciate your time with us today. All
Thanks,
right,
everyone.
students, I'm going to show my screen one more time. And in this screen, you're going to see a QR code. And on that QR code, if you want to go ahead and get your phones ready, we want definitely for your feedback to help us know how this event impacted your decision to join healthcare. And also, how can we improve this in the future? I'm sharing my screen right now, and you'll see that. And on there, you'll see that QR code. So go ahead and pull your phone out, scan that picture, go to that QR code, and fill out that survey. We are thankful for your attendance, and we support your decision in pursuing a career in healthcare. As you saw from all of our presentations today, imagine your future in healthcare. If you can visualize it, you can achieve it, and we are here in support of that. If there's anything we can do in the future, please do not hesitate to reach out. Goodbye, and thank you very much.